In this video, we are going to talk about what your Bowel program might look like if your injury is above T12. The learning objectives are listed above. We're going to talk about what a successful Bowel program might look like, specific techniques used in Bowel programs, and additional ways to support your bowel management. The entire goal of establishing a bowel program is to ensure your bowels are regularly emptied at the same time every day using the same method. Bowel programs reduce the risk of accidents, constipation, impaction, and can give you more independence. Creating a bowel program that works best for you will take some trial and error, but remember that consistency is key. Diet, fluid intake, activity, and medications will all affect the consistency of your stool. The goal is to have soft, formed stools. Most people with upper-level injuries utilize a suppository, perform digital stimulation, and or use a mini enema to help stimulate the body's reflex to defecate. Your bowel program may change as your body changes, and that's completely okay. For example, some people might start by using a suppository and digital stimulation in their program, but will eventually be able to have a bowel movement with only using digital stimulation. A successful bowel program should provide predictable and reliable results, take less than 30 minutes per day, have minimal side effects, require the fewest number of medications and surgeries as possible, allow for at least 3 bowel movements a week, and will be performed at the same time, whether every day or every other day. Keep in mind that the optimal time for your bowel movements is within the first 2 hours after you eat. This is when the colon is the most active. To design a successful program for yourself, you should talk to your healthcare providers about your mobility status, including your ability to transfer, your balance, and your hand function. After discovering the appropriate position for your program, you can use diet, fluids, and medications to create a stool consistency that works for you. It's important to record the frequency of your bowel movements and check the skin on your bottom to prevent any kind of skin breakdown, damage, or wounds. Some techniques that can be used in your bowel program can be digital stimulation, suppositories, or enemas. Overall, any of these techniques should be done every day at the same time to help train your body to get on a schedule. Suppositories are small solid capsules that are inserted into the rectum to promote a bowel movement. You can only use one every 24 hours. Pictured above here is an example of one of the inserters that can help to place that suppository. It works in 2 ways, increasing pressure in your rectum and releasing medicine. An enema is a liquid medication that is given rectally to help clear stool from the lower part of the colon. This works similarly to a suppository. Suppositories typically take within 20 minutes to an hour, while enemas work in 5 to 20 minutes or less. After allowing the suppository to dissolve or the enema to be given, either you or a caregiver will insert a gloved, lubricated finger into the rectum and gently rotate it for 10 to 20 seconds. You will then wait for 5 to 10 minutes, see if you've had a bowel movement. Another option instead of using a finger is also to use this piece of equipment shown above right here, the digital bowel stimulator. If you do choose to use this option, just make sure that it's also lubricated as well. It also might be helpful to use your finger to manually remove stool from your rectum. This will speed up your ability to empty your rectum. Some things to keep in mind is to always be sure to wash your hands before and after completing your bowel program to reduce your risk of infection. And prior to inserting a suppository, you can check the rectal vault using a lubricated gloved finger to be sure that stool is not blocking the bowel. If stool is present, gently remove it. It's a good idea to transfer to a toilet or bedside commode about 15 to 20 minutes after suppository insertion so that you can complete digital stimulation. Since enemas work faster, if you're able to, they should be inserted while seated on the bedside commode about 20 minutes after eating. Overall, your entire bowel program should take no longer than 1 hour and should be performed every other day. If it's taking longer than this, please tell your healthcare team, including your doctor. If your injury makes you unable to follow a bowel program, then surgery may be an option as well. The most invasive and helpful surgery is the colostomy. It does require general anesthesia to be used. A part of the distal colon is attached to the abdominal wall, where stool collects in an external bag that is tightly attached to your skin. The colostomy can be reversed if the person decides they would like to return to their previous state or functioning. As you can see in this picture here, this is a piece of the colon that has been brought to the surface so that the stool can drain into this collection bag. Additional ways to support your bowel management program include exercise and standing. Exercise and standing are great ways to improve intestinal motility. The best kinds of exercises to stimulate the bowels include those that increase your heart rate and cause you to use your breathing muscles and abdominal muscles. Standing is the simplest way to improve bowel function, and gravity will help move the stool through your intestines. You can always use a standing frame if needed, which we talked about in a previous video. Just a refresher, this is what a standing frame looks like, so this can also be an option for you as well. Another way to support your bowel management program is to work with your healthcare team to decide the most appropriate medicines for you. Your doctor may have you take one or more medications, either orally or rectally. It could be stool softeners that make your stool soft and easy to move, a stimulant laxative that stimulates the colon to move stools, a bulking laxative to add shape and form to your stools and prevent diarrhea, or a rectal laxative that helps with rectal movement and emptying. And that's all of the basic information that we would like you to know initially when going to create a successful bowel program. Again, please reach out to your healthcare team and they can help you through this entire process.